Hey everyone, my name is Samantha, a team member with SM Nursing Reviews. Today we are going to be breaking down another next generation NCLEX question style, the multiple response select end question. This is one of the new next-gen NCLEX question styles you may see on your exam. But remember that these newer style of questions only make up about 30% of your exam. So the majority of it is still those typical multiple choice questions. Today we're going to explore this question style with a very popular fundamentals topic, isolation precautions. So if you find yourself needing a refresher on this topic, definitely check out our crash course. Let's quickly review what these questions entail. So you may be asking yourself, what is a multiple response select end question? Well, this is just a fancy way of saying a select all that apply question, but with a nice twist. The select N means they tell you how many to select. For example, it may say select 3 of the following risk factors, or select 4 possible side effects of this medication. And when you get to these questions, close your eyes, take a couple deep breaths, and give it your very best guess. For scoring on these, you get 1 point for each correct selection and 0 points for each incorrect selection. And something even better than them telling you exactly how many to select here, you can get partial credit for any of them correct instead of all. So always give it your very best effort. And this is huge, something I definitely wish I had on my NCLEX when I took the older version. You can absolutely do this, you all. Now let's jump into a quick practice question to set the stage for our isolation precautions and our multiple response select end question. We have a 4-year-old girl who presented to the emergency room with her mother for concerns of a fever and facial swelling for the last 2 days. Her past vital signs include the following. Heart rate is 120 beats per minute. Blood pressure is 87/60. Her respiratory rate is 22 breaths per minute. Her oxygen is 97% on room air, and her temperature is 103.2 degrees Fahrenheit. There are no known drug allergies, and we have no past medical records or medication history available for this client. While reviewing the chart, you notice that the triage nurse documented notable bilateral swelling on the face, just in front of the ears. So let's stop here and do a quick knowledge check question to make sure everyone is on the same page. What gland is most likely affected in this client? A, minor salivary gland, B, parotid gland, C, sublingual gland, or D, submandibular gland. If you need a minute, that's okay. Go ahead and pause and start when you're ready. So the key here is the location of the swelling. On the side of the face, near the cheek or the chin, just in front of the ears. The parotid glands are the largest of the salivary glands and are located just in front of the ears. So let's do some clinical reasoning here and think about what condition is most likely affecting this client. Because before we can get into talking about any type of precautions, we need to know what we have, right? And what condition do we think of in children with that parotid gland swelling? If you're thinking mumps, absolutely. And when we review the rest of the chart and get our shift report from the previous nurse, we do see a positive test result for mumps. Okay, friends, here is our multiple response select end question. A good thing to do is ask yourself with each selection, does this make sense in relation to the question being asked? If you think of it this way, it does not seem as overwhelming and we can logically think this through. So let's do it. The registered nurse is preparing to do a physical assessment on a pediatric client diagnosed with mumps. When preparing to enter the room, the nurse gathers which 4 pieces of personal protective equipment or PPE. Select all that apply. A, eye protection. B, face shield. C, isolation gown. D, standard mask. E, N95 respirator, or F, nitrile gloves. I know that's a big question. Go ahead and pause if you need to and jump back in when you're ready. All right, friends. So the first thing we need to do here is think about what type of isolation precautions are most appropriate for a client with mumps. Does anyone remember what those are? Droplet. What is a great way to remember the main conditions that require droplet precautions? Well, in our crash course, we have a variety of mnemonics, so be sure to check that out if you haven't already. For droplet precautions, I always think of the word Spider-Man. It stands for sepsis, scarlet fever, streptococcal pharyngitis, parvovirus B19, pneumonia, influenza, diphtheria, epiglottitis, rubella, mumps, mycoplasma or meningeal pneumonia, and adenovirus. So, mumps fits right into that M in Spider-Man, which helps me remember that this is droplet. And when a client is placed on droplet precautions, of course we're going to perform hand hygiene as always, wear gloves and a gown, and also a mask and eye protection. Making eye protection and just eye protection like goggles suffices. You don't have to have a full face shield here. A gown, mask, and gloves, those are going to be the correct selections here. Now, when I think of conditions spread by droplets, I think about any type of droplet that can travel in the air, such as when a person sneezes or coughs. Like if someone that has the flu coughs, a droplet is so super tiny, but can land on another person's mouth or nose if they're within 6 feet. So when you think of it that way, it really makes a lot of sense that these are the barriers or the PPE that we're going to need. And that wraps up our video, friends, on multiple response select N questions. Remember your steps and work through those questions one selection at a time. You can absolutely do this. Always give it your very best guess. Thanks for joining me today, and be sure to hit subscribe so you don't miss out on our latest videos. See you next time. Happy studying.